after giving a beautiful explanation regarding the maternal recognition of pregnancy, let us now draw that master flow chart. This maternal recognition of a pregnancy is the keyword which is otherwise known as MRP. So this is that keyword which we are going to deal today. So the first point is that this is the signaling from the conceptus or the embryo, to sustain the corpus luteum alive. That's the most important point. It means it is a survival signal. No doubt, it has biochemical, physiological and endocrinological significance. And we should not forget that these particular maternal recognition of pregnancy is different from different animals. In the ruminants, it is interferon-tau. But in case of pig, if you see, it is estrogen, prolactin as well. In case of rodents, it is prolactin. But in case of human or primates, chorionic gonadotropin beta. And in human specific, human chorionic gonadotropin. So that means definitely the conceptus is giving a signal. That's what known as MRP. Then now question arises, what's the outcome? Yeah. So that is another point. The fourth point, that it's a biochemical, physiological and endocrinological with the corpus luteum. This point is important. The corpus luteum is surviving. That means it is showing anti-luteolytic effect. That means it is preventing the process of luteolysis. It will not cause the lysis or the demise of the corpus luteum. So it is preventing that. That's fine. And also, it is further supporting, this is important, luteotrophic action. That means it should survive in it and go on secreting the progesterone, which is required to keep the pregnancy on. We should not forget that progesterone is the hormone which makes the uterus to prepare itself for the process of implantation, placentation and gestation. Glandular, vascular, muscular, all the changes what occur in the uterus during the time of this is mostly mediated by progesterone. Coiling of the uterine arteries, even the supply of the angiogenic factor, the histotrope secretion, the quantum of hormonal effect and activity, all are mostly regulated by progesterone. So the take-home message is that progesterone is the master. But we should not forget the master is actually the corpus luteum, which is maintaining all these activities. So the next point, the relevant point, is that during maternal recognition of pregnancy, we got this word in case of ruminants, and we'll be focused on that, interferon-tau. And this interferon-tau, I am writing like this, interferon-T. And this is that interferon-T which prevents luteolysis. That's the point, that it prevents the luteolysis. So how? Now it prevents the luteolysis by the inhibition of synthesis of the PGF2 alpha. So we should not forget this, that the PGF2 alpha is the culprit for the luteolysis, and the interferon tau, it is rather supporting this PGF2 alpha to be inhibited. That is this particular lecture. We will see how this is. Along with this interferon tau is immunogenic. That means it shows immunogenic response. It is antiviral. It is Proliferative means cell proliferation, so it is proliferative in function. It's also anti-apoptotic in function. That means these are some of the key functions of this interferon tau along with this luteolysis inhibition. Now guys, to further go into the detail, let's think what actually happened. Why this interferon tau is really sustaining the pregnancy, and that's what known as conceptus signaling. So we have to understand the logical basis. So we should draw another diagram to see what actually happens. Now let's draw the master flow chart which will show the status of ovary, uterus, how they are playing the important role in the regulation of MRP. Let's draw it. Let me show you a simplified diagram. This is the ovary. Sequence wise I will explain. This is ovary. You are seeing primary follicles, little bit bigger secondary follicles. Then the tertiary follicles will take a follicular class, complete follicular class, but for the time being. So here you are seeing the oocyte, which is surrounded by multiple layers of granulosa and theca cells. And here, actually, that word is Graafian follicle, or what we are saying as mature follicle, dominant follicle. It is around 18 to 20 mm size in a cattle. So that is undergoing a very specific concept, that this mature follicle is showing the master cells which are known as the granulosa cells. Okay, two cell to gonadotropin hypothesis also will cover. This granulosa cell is gradually secreting this master hormone, what we are saying as estrogen. Estrogen has three very important functions, and that we have to understand if we can understand the MRP. What is that point? Estrogen goes via the blood to the limbic system and higher centers of the brain, and it will introduce behavioral stress. This is the symptom which is shown by the female, that is behavioral stress. What is the second point? Behavioral stress means it will show the stress behavior for the acceptance of the male. This is increase sexual urge for copulation or the male partner. Okay, the second one is this estrogen will go to blood. As it is so much high, it will trigger the hypothalamus, where it is going to stimulate the LHRH neurons, the luteinizing hormone releasing hormone. This will act on the anterior pituitary, on the luteotroph cells, and secrete LH. And this LH is surge, and that's commonly known as the LH surge. Due to this increased LH, now this is the LH surge which will lead to the process of ovulation. We should not forget this endocrine basis. This estrogen acts on the uterus. This is permissive action of uterus. Estrogen on uterus. What it is doing? Now it is acting on luminal epithelium of the uterus, and it's acting on surface glandular epithelium. And in which phase you are? You are in the follicular phase or in the proestrous phase. So try to understand that concept. Once this is, what it will cause? Now it will increase the ESR1 expression, that is estrogen receptor 1 or estrogen receptor alpha. This will increase the oxytocin receptor expression. Yes, this is that point. This expression is increased. And this is the function of, dynamic function of, I can say, the estrogen, dynamic function. So if I can show a diagram, it is just like this. This is the endometrial lining of the uterus and this is cervix on the bottom side. So you are seeing here the expression of estrogen R1 receptors. These are the estrogen R1 receptors which will respond to the estrogen like this. And second, these are the oxytocin-like receptors. These are the oxytocin-like receptors. And they are on the surface epithelium or glandular epithelium and luminal epithelium. What you are saying this one is the oxytocin receptors. And what you are seeing here, this is this one. You are seeing the ESR. Progesterone receptor has not yet started, but expression is there. I'm just keeping there. Now try to understand what will happen to this word ovulation. Next, go to the ovary. This mature follicle will now give rise to the oocyte, which will come outside. This is now the oocyte. These are the follicular theca cells, granulosa cells. They will come out. What we are saying? We are saying as ovulation. Where you are in the oviduct. What is the structure change now? It will change into corpus luteum. Already I have presented in the corpus luteum class, small cells, large cells. The small cells are derived from theca cells. The large cells are derived from the granulosa cells. They are the major cells which will secrete progesterone. What structure you are seeing in the ovary? This is corpus luteum. And what you are getting in the oviduct? You are getting a secondary oocyte which is waiting for the sperm to come. Suppose the sperm is there, because we have to show conceptus signaling. That's why there is no chance of failure. I will explain. I will say the sperm will come and fertilize. So here you are getting the secondary oocyte which is waiting for the sperm, and these are the sperm which are coming and ultimately they fuse. And that process, what we said, is the fertilization. Simultaneously, we are expecting, you are in the oviduct, you are still in the oviduct, and here the fertilization has occurred and the zygote has formed. But what is the structure? This corpus luteum is now the granulosa cells. The granulosa cells will convert it into large luteal cells, and that is also done by the same hormone LH. Here, this LH. So once this LH is converting large luteal cells and theca cells, you can see the detailed video of corpus luteum so that you can understand. The small luteal cells, so these are the predominant progesterone secreting cells, progesterone. So now students, try to understand, this is the proestrus stage where estrogen is peaking. In the estrus, we are telling that LH is secreted, ovulation has completed. Day 0, we will say the estrus is the day 0, suppose. So after 12 to 18 hours, this ovulation has taken place. Means, let it be 18 hours. Means almost a day. After that, what stage you are seeing here, that is the met estrus. I can say it will last for 1 to 4 days. And in that, you are getting a functional corpus luteum, which started secreting progesterone. And under the influence of progesterone, now please see this uterine diagram. In the progesterone, what it will do, now it will start expressing the progesterone receptors. These are the progesterone receptors. They have very, very dynamic role of hormones. So this is the PR1 or PR4 receptors. That means the receptors for the hormone progesterone. So almost metastasis is over. You can see a very balanced picture. Now what is happening? Now from the large luteal cell and small luteal cells, now next phase will start distress. Metastasis is over. You are having, suppose from 4th day to up to 12th day. That means almost around 8 days to 10 days. What will happen? Progesterone will pick up and pick up. But estrogen is now grounding out because granulosa cells already have been converted to the large luteal cells. So try to understand estrogen is falling. So now come back. This estrogen, what you are seeing, this estrogen 1 expression and its dependent oxytocin receptor, now they start decreasing. Why? Because of progesterone. So try to understand up to 12th day of this conceptus, when it is present, elongation just going to start. Up to that, progesterone is doing down regulation of ESR1 receptor, down regulation of OXTR receptor. What is the next point? It also down regulates prostaglandin synthetase 2 enzyme. This enzyme is the master enzyme for the prostaglandin synthesis. This estrogen, what you are seeing here, this also causes the higher expression of this. We can put another point here. This estrogen also increases the expression of prostaglandin synthetase 2. Its expression increased. But in the presence of progesterone, it is down. So ESR1 down, oxytocin receptor down, PS down. Also this estrogen, and we can add 1, 2, 3, another function, suppose for example 4, it also increases phospholipid arachidonic acid release. It also means this is the fourth function. So in the presence of what? Progesterone, the phospholipid release also decrease. So this is the function of progesterone. And you are covering 12th day. The conceptus, which is spherical, now it is going to show elongated to filamentous. That means, I think, guys, you are understanding this. So now we can draw here spherical conceptus. It will become elongated. It will become filamentous. I can go to another flow chart also. This spherical, it secretes around 314 nanogram per ml interferon-tau. This elongated around 1000 to 1200 nanogram per ml. This is in U. For your understanding, I'm showing. And around 4400 nanogram per ml. That means the filamentous form is important. How many days you have covered? If it is 12, then from 13th day, spherical will convert it to elongated. 14th day to 15th day, elongated to filamentous. 15 to 17 days, filamentous is very active. That means, now if this is the concept, then 15 to 17 days, the maximum concentration of interferon-tau is visible. This is the point to be noted. And why this is? This is due to the filamentous conceptus. So hopefully this flowchart is very clear to all of you for making a very good understanding. Now let me draw another flowchart which will show the value of this uterus. We'll modify that one, and also we'll try to see how interferon-tau is acting. So with this, I'm coming to another flowchart. Just have a look how they are interacting. So I'm just continuing this chart for your easy understanding so that you can draw a very vivid conclusion that what actually really happening during the time of this maternal recognition of pregnancy. Very complicated phenomenon, no doubt. Endocrinologically, genetically, means at molecular level, so many signaling mechanisms are associated. Let's begin again. So what is that? Spherical conceptus. It has elongated and it is now filamentous. If this is the concept, we can say this occurs in between how many days? Now 15th to 17th day in case of the cattle. If we are saying this, then interferon-tau is there in our picture. What's the function of interferon-tau then? Try to understand. Up to 12 days, progesterone during the phase of, you can say, metastress is over. After that, the distress is there. So, like this, I can say stress, that is 0 day. Then we started with this word metastress. We completed 1 to 4 days around. Then we started with this word distress, where we are seeing the corpus luteum fully functional, 5th day to 12 days. So after that, we are getting a very big concentration of progesterone. And due to this high progesterone, the estrogen, ESR1 receptor is downregulated. The oxytocin receptor is downregulated. The prostaglandin synthetase 2 enzyme is downregulated. The phospholipid release is also decreased. This is because of progesterone. But science is still not knowing. This blocking action, why suddenly drops after 12 days? It is not known. It is seen that the blocking effect of progesterone on these is suddenly falls. It becomes insensitive. Now, God has created the survivor, because if the action of the progesterone will fall, their expression will increase. And once they are increased, then prostaglandin will be released, F2 alpha, and it will cause luteolysis. But we don't want to kill the corpus luteum. So this is that beauty. So what will happen? Now this interferon-tau will be secreted on 17th day, and it will try to keep the prostaglandin F2 alpha to not to be secreted. That is, luteolytic phenomenon has to stop. And it will also increase the luteotropic effect of the progesterone. So the miracle happens here. As I said, that this is secreted from the trophoectoderm cells of the conceptus, already I have explained. And this is usually a glycosylation is being seen. This glycosylation is not common in all, but yes, this glycosylation is being seen. In case of cattle, it is glycosylated. In case of use, it is not. But anyways, it is there. So what actually happens? Now, this protein, this interferon-tau, which is almost 19 to 24 kilodalton, sometimes little bit more because of depending on the glycosylation pattern, this particular one is going to play the critical role. And if you see the amino acid sequence, it is 172 amino acids. It is stable at acidic pH even between 3 to 4, means this is the pH range, optimal pH range. This is stable, and this is also having the disulfide rings, SS bonds, and these SS bonds are present in them between the amino acid 199. This is for objective pattern of question 1 to 99, as well as it is between 29 to 139. This disulfide bonds are present. This is for your information I am saying. This is not that important, but yes, this is that point. and during the filamentous, it secretes around 15 to 20 times more interferon-tau, that we have the information. Now what will happen? This interferon-tau will bind to its receptor, that is interferon-tau alpha beta chain receptor, and it will activate the Janus activated kinase JAK and STAT. We will take another one. If signaling you want to really know, then I will take another lecture where I'll tell how this downstream mechanisms occur. But for the time being, it will activate the JAK STAT pathway, the transcription factors. Progesterone is already have less blocking effect on this. Now what will happen? Now these last 4 points are critical. So now what will happen? This interferon tau will silence the ESR1. This is the master. It will silence the ESR1 transcription. So once it will be silent, then the second, of course, from here, OXTR gene expression is inhibited. This is the function, and that's why this is important. It will inhibit the prostaglandin synthase 2 inhibition. It will also inhibit the release of the phospholipids and particularly the arachidonic acid. So see how important this molecule interferon tau is. 4 very important functions which were carried out by progesterone, but progesterone after 12 days suddenly stop showing the action. And do not forget that these are in the luminal epithelium of endometrium and surface glandular epithelium of the endometrium. So we should not stop. And what has happened? If this will occur, it means the outcome is here. The outcome is PGF2 alpha synthesis is inhibited. That's what we wanted. And that's what is known as maternal recognition of pregnancy. Once this is inhibited, what will happen? Now the luteolytic action, luteolysis phenomenon of the corpus luteum is inhibited. And due to this, now the corpus luteum will remain in the ovary. What we are saying, corpus luteum virum, large corpus luteum of pregnancy. And this corpus luteum will now start secreting progesterone. And this progesterone is now to carry out the pregnancy, successful pregnancy. So is it not interesting, students? It's very interesting, very dynamic. How the nature is playing the important role inside. Once progesterone is showing insensitivity, God has given this interferon tau, the master. The master will come for the savior. And that's why I said the concept of talk with the mother. Mother, I want to live. And mother says, yes, don't worry. I am having something for you for which you are going to survive. And that's the crosstalk. We have to understand that. And this crosstalk as a whole will support the process. So here what you are seeing is the entire process what I wanted to convey you people, that oxytocin receptor, if it is downregulated, then it will not allow the prostaglandin F2 secretion in pulsation. So let us draw the final flow chart. Already I have explained the concept. Now let us draw the final flow chart and complete this lecture. Okay. This is quite interesting. This is quite interesting, but it is not yet understood in vivo models because of complexity of pregnancy and uterine epithelial, uterine microenvironment. But yes, a lot of development has made. So what I am saying, this is already done, it is already known. So let us draw that final one so that we can understand. This is the final take home flowchart. Estrogen increases ESR1 expression, OXC, oxytocin receptor expression, prostaglandin synthetase 2 expression. This is estrogen. Whereas progesterone, it causes ESR1 down regulation, OXTR down regulation, PGS2 down regulation. This is the function of progesterone. This is the function of estrogen. Do not forget, guys, because this is the final flowchart. What's the requirement of oxytocin receptor? Now, oxytocin receptor, oxytocin binds to this oxytocin receptor, and there is, this point is important. Once it binds with the oxytocin receptor, it increases PGF2 alpha secretion, which is required for luteolysis. Remember, in case of primates, this PGF2 alpha, this is always important, primates, it is intra-ovarian. And when we are talking about ruminants, we are saying it is from uterus. So it is intra-ovarian in case of primates. Non-primates, it's uterine. So luteolysis, pulsatile secretion, this is pulsatile. And this pulsatile range between 4 to 6 cycles, pulsatile cycles. Once PGF2 alpha secretion increases due to oxytocin receptor, luteolysis occurs. Then what interferon-tau has caused? This interferon-tau, through its receptor, through its receptor, interferon-tau alpha beta chain receptor, it has down-regulated ESR1, it has down-regulated the OXTR, down-regulated. Consequence, PGS2 is also down-regulated, and thereby there is inhibition of PGA2 alpha synthesis, decrease and then inhibited, and then decrease and inhibited the PGF2 alpha release. And once this will happen, then luteolysis is inhibited. And once luteolysis is inhibited, then luteotropism is seen. And this luteotropism will maintain the Cl that will convert it to Cl, virum, or the corpus luteum of pregnancy, and that will start secreting the progesterone. So remember this. This is silencing. This is silencing of ESR1. This silencing will cause silencing of ESR1. This will decrease the gene expression, decrease silencing of transcription. So we should not forget, and therefore the oxytocin will decrease. So with this lecture came to a conclusion, but we should not forget that this progesterone, which is now maintained, it will bring out the nitric oxide synthesis inside the uterine blood vessels, and it will regulate the blood supply to the uterus, because pregnancy is going on, heavy blood supply is required, and further this progesterone is also, I can write here, this progesterone is also acting on uterine glandular epithelium, and it synthesizes a protein uteroferin. This uteroferin is required for the blood cell formation and further growth and development of the fetus. So many activities are being mediated by this master molecule interferon-tau. So with this, I came to the conclusion that how maternal recognition of pregnancy occurs. In case of primates, it is due to the chorionic gonadotropin beta. In human, we are saying it as human chorionic gonadotropin. And we should remember that the entire mechanism is to stop the estrogen receptor expression, the oxytocin receptor expression, so that the oxytocin, what is being secreted from the secreted from hypothalamus or released by the posterior pituitary, will not bring out the pulsatile secretion of PGF2 alpha. So thank you so much for the patient hearing. If you like my content and this particular lecture, please do not forget to like my channel, subscribe my channel, share with others, and I can wish a wonderful time ahead. Keep learning. Let's meet in the forthcoming lectures with some more interesting topics in the scope of reproductive physiology.